Dr. Eric Henry, Everyday Physio Physical Therapy here, and this morning I want to talk about some of the exercises after recovery from a hip replacement surgery. If you have a hip replacement, whether they use an anterior or posterolateral approach, they're going to involve the gluteus medius and the tensor fasciae lata, the two muscles that sit over the edge of your hip joint. And one of the standing exercises that I like to do, we'll start this exercise in sitting, and just put the chair out here. And I'll usually have start with a move out to the side. We'll just be demonstrating for an imaginary right hip surgery. So just slide your foot out to the side, then back to midline. And as we progress this exercise in sitting, I will usually put a resistance band around the thigh and 10 to 15 repetitions. And then we'll progress that exercise to standing. I usually do this at the kitchen counter. I'm just going to use the back of the chair for support. And you're just kicking your leg out to the side, then back down. So you can see what I'm doing. And just out to the side, back to the middle. Nice smooth repetitions. You don't have to go way out here like this. Don't have to be Chuck Norris. You just have to get out far enough to feel that muscle engage. And then the left side, just the opposite. And I'll usually have patients do that standing at a kitchen counter where you can have something for support. And then just out to the side. And again, I couldn't find any resistance bands. I gave my last one away, but that would be a progression of this exercise to put a band around. And definitely hold on for support if you use a resistance band to kick out to the side. And progression of that is a side step, which I really like because not only does it work your hip joint, but it also works some of the muscles in your lower back and helps you to balance. So it's just a step to the right, and now I'm thinking about Rocky Horror Picture Show, and then a step to the left. And again, I'll usually have that exercise done along the kitchen counter at this little half wall here, and just touch for support, side step, and side step back. Good posture, and as always with all your exercises, make sure you are breathing in through your nose, out through your mouth, and keeping that good upright posture so that the muscles in your back can work the way they're supposed to. So that's it. Pretty basic exercise for hip abduction, strengthening that gluteus medius and working on the muscles that bring your leg out to the side. Those are important hip stabilizers. Gluteus medius muscle is a very important muscle because when you're walking, for example, again, if your right hip was involved, when you're taking a step with that left leg, your right glute medius is helping to stabilize your pelvis and your trunk. So it's a very important muscle to regain function after you have a surgery. So thanks, guys. Appreciate you watching. Please subscribe and like. And if you have any questions, drop in the comments.